Welcome, parents, future parents, and even grandparents. I'm Dr. Dan, and today we are discussing what really causes an ear infection and how can you avoid them altogether. I have so many children that have come through my office that we have helped with ear infections, or parents or grandparents with questions about ear infections, that I wanted to take some time and put this presentation together so that we could really get to the bottom of what causes an ear infection and how we can avoid them altogether. So thank you for joining us for this week's half hour for your kids' health. Let's jump in. As always, our disclaimer, this video is for information only and it is not intended to diagnose, treat, cure any health conditions. And if you have questions about this information, contact your trusted health professional. If you don't have a trusted health professional, contact our office and we will help you find one near you. So ear infections, or more commonly known as otitis media in the healthcare world, OM for short, is simply an inflammation of the middle ear. I'm going to get to a picture in the next slide. But inflammation of the middle ear, common symptoms associated with children who have an ear infection or otitis media. Number one, the most common is it's going to be painful. Usually because of that pain, there's going to be pulling on the ears, like this beautiful kid we have here pictured. There could be redness and swelling of the tympanic membrane. Again, we're going to get to a picture of where that anatomy is. That's actually diagnosed with an exam by your healthcare professional. Because of pain, again, rolling back and forth and sleeping on that ear can be very uncomfortable. So there could be sleep disturbance in your child. And if it's severe enough, if it's chronic enough, if these infections last long enough, you can actually have hearing loss. And that's really the biggest worry that that people have in the healthcare world with this otitis media or ear infections, because if you have a hearing loss, especially at a young developmental age, it can have impacts on your language and academic development. Two factors that must be present in order for otitis media or inflammation of that middle ear to occur. Number one, there must be an infection agent, such as a virus or bacteria. And number two, you must have a narrowed or closed off eustachian tube. So let's take a look at the anatomy of the ear so that we can really understand why these ear infections occur. So here we are, the anatomy of the ear. So the outer ear is designed to capture sound waves on the left-hand side there, and then those sound waves go through the ear canal and hit the eardrum. The eardrum is also known as the tympanic membrane, which I mentioned in the previous slide. And when that eardrum starts to vibrate, it moves the three bones of the middle ear, the malleus, incus, and stapes, right there. So the malleus, incus, and stapes are then designed to vibrate, and they are up against the cochlea, which is that snail shell looking doodad, and the three bones of the middle ear vibrate fluid throughout the cochlea, and then the nerve fibers that are attached to the cochlea are activated and send the nerve message to the brain, which is how we interpret the sound waves as sound and we hear. So that is how we pick up sound, and that is how the ear is supposed to work. Now, if you look at the middle ear, there's also a drainage tube known as the eustachian tube, which drains down into the back of the throat. Well, why would it do that? Well, here we go. Anywhere you have an external opening, so the internal body is exposed to the external world, okay? Think of like your eyes, your nose, your mouth, your ear. You have those openings, you're going to have collections of white blood cells or immune cells. Well, why would we do that? Well, again, our body is intelligent. It wants to stop foreign invaders as they enter or try to enter the body. So we have these collections of white blood cells in the eustachian tube, so that if any viruses or bacteria start to make it in through that eardrum, then the white blood cells will capture them. They'll break them down, and then the body naturally, normally drains them out, drains that fluid into the back of the throat so that you can either swallow it or cough it or sneeze it out. So again, a very, very intelligent design. Now, in a young infant or a child, that eustachian tube, you can see in this picture how the eustachian tube is at a bit of an angle, so that the fluid very easily can drain down that angle. The problem with infants and young toddlers is that the eustachian tube sits at a more horizontal angle, so there's more of a chance for fluid or the inflammation material to sit and build up. If it sits and builds up and it's not draining properly, well, that's where you can really start to put a lot of pressure on the bones of the middle ear and the eardrum, and it can actually interfere with hearing. The other thing, if you think of a really bad infection, if you've ever had this as a child or an adult, if you have a really bad infection, you also can have balance issues. If you look next or right above the cochlea, you have something called the semicircular canals. So if you have balance trouble, especially during an ear infection, it can also put enough pressure so that those semicircular canals, which are responsible for orienting your body in space, that area is inhibited because of the pressure of the infection. So that's how the normal ear is supposed to work. But one more thing I want you to pay attention to, which are two little muscles at the very, very bottom there, which are designed to open up that eustachian tube, the tensor and levator veli palatini. Okay, those two muscles are designed to lift the back of the throat, but as they contract, they're also designed to help open that eustachian tube and keep it clear so that fluid can continue to drain properly and there's never a buildup, there's never an infection. So remember, the two causing agents of an ear infection. You must have an infecting agent, which is going to cause the immune system to kick those immune cells up and start forming the collection of immune cells, but then you also have to block that eustachian tube. So let's remember that when we talk about how we actually work through an ear infection. So there's two major ways. There's a medical approach and a functional approach to working through ear infections. The medical approach focuses on that, number one, the infecting agent. Okay, where they actually want to prescribe an antibiotic to help fight that infecting agent, which is causing the inflammation in the ear. Otitis media, okay, the ear infection, is the number one reason that medical doctors see children in their office. So it's the number one reason. In fact, 40% of all antibiotics prescribed in children who are less than 5 years old are directly for otitis media. That's an estimated $2.8 billion annually spent on antibiotics for otitis media. Now, interestingly enough, another medical approach that the CDC says is okay is the wait-and-see approach. And it's been estimated that 70 to 80% of all otitis media cases will resolve on their own just by waiting and seeing how the body processes. Just as I explained before, the body is naturally designed to capture that infecting agent, break it down with the immune cells, and drain it down the ear. In fact, one study of over 3,600 children found that those following the wait-and-see plan, they actually recovered at a higher rate than those who were prescribed antibiotics. So those are some of the statistics of our current medical approach when we look at what to do for an ear infection. Now, if the ear infection does not clear out on its own with a wait and see, or even with antibiotics, it does not clear out on its own. If you have 4 to 6 months of hearing loss, or you have 4 times recurrence per year. Okay, so basically you're getting 4 recurrences of otitis media per year. Now you're considered eligible for a tympanostomy, or what's considered tubes in the eardrum. Tubes, tympanostomy, the tympanic membrane, ostomy meaning a hole. So a tympanostomy is tubes being inserted in that eardrum. So this is actually my own experience. When I was 18 months old, I had several rounds of ear infections that were not clearing up with antibiotics. So at 18 months old, I had my first rounds of tubes. Now, interestingly enough, I still then got ear infections over the next several months. So by the time I was 3 years old, I had a second round of tubes put in my ears. In fact, 1 in every 15 3-year-olds in the United States has tubes in at least one or both ears. Okay? Now, these tubes, or the tympanostomy, accounts for 20% of surgery in all children under 15 years of age. Okay? That's a lot of surgeries. That's a lot of tubes in ears. Now, interestingly enough, one study showed that 98% of children who have these tubes, so 1 in every 15 3-year-olds have these tubes, 98% of those that received tubes have a recurrence of otitis media within 2 months. And that's what happened to me. And it happened frequently again that I actually had to have them a second time. Okay? A long-term study on academic outcomes and language development showed that the wait and see approach was exactly the same for those who received tubes in their ears. What does that mean? Well, if you're following the wait and see approach, you're probably going to have the same outcome. So I always go back to the why do it at all? And fast forward now to where I am in my life, I have a 7-year-old and a 3-year-old son, and neither of them has ever had an ear infection in their life, compared to me that had tubes in my ears twice when I was 18 months and 3 years old. So the question becomes, is this procedure overused or not? You can make your own judgment. Let's look at something beyond the medical approach. So now let's look at chiropractic and otitis media, the functional approach for helping children with ear infections. Remember, let's review. There's 2 factors that must be present for otitis media to occur. Number 1, which is where the medical approach really focuses on the infecting agent, the bacteria or the virus. Now, interestingly enough, bacteria and viruses, do you think they're just sometimes present, or are they always present? Well, the answer is that they are always present, and we're always being exposed to them in any openings, which is why I mentioned before, there's always going to be collection of immune cells anywhere the body is exposed to the outside world, such as your mouth, eyes, nose, ears, okay? So the second factor that must be present for otitis media to occur, just in review, is the narrowed or closed eustachian tube. That's where chiropractic is going to focus on the functional approach to actually opening up that eustachian tube, and I'm going to talk in a minute why that works. But when you open up that eustachian tube and allow the body to drain that fluid where it's supposed to go into the back of the throat, then you never have the opportunity for the buildup of the inflammation, which presses on the eardrum and can cause all those symptoms we discussed at the beginning. Okay, so let's look at the functional approach and how chiropractic works with children who have ear infections or OM. I'm going to use this diagram to make the very simple point of how a chiropractor could help a child, an infant, or an adult with otitis media. Here's the deal. You see the eustachian tube in green. Just underneath the eustachian tube, it's not labeled in this diagram, but were 2 muscles that I talked about in the earlier ear anatomy diagram, the tensor and the levator veli palatini muscles. Those muscles have a nerve pathway very similar to the nerve pathway that is shown on this diagram, where the vestibulocochlear nerve travels from the cochlea, sending nerve messages about sound back to the very base of the brain, known as the brain stem, and then up into the cerebrum, where we actually interpret those sound wave messages. In a very similar respect, the muscles that are below the eustachian tube follow a very similar pathway up through the brain stem, right where those two red dots are in the picture on the right. The two red dots, they go in through that brain stem up into the brain. And that is how the brain coordinates the contraction and relaxation of those muscles. When those muscles are contracting properly, the eustachian tube is able to open and drain properly. If they are not contracting properly, then the eustachian tube has a more difficult time opening up and a much better opportunity for closure, and thus the second point, which needs to be present for otitis media, a closed eustachian tube. So how does a chiropractic adjustment or a chiropractor make an impact on that nerve pathway? Well, if you look at those two red dots, just below those two red dots where those nerve pathways are following sits the very, very top bone in the spine known as your C1 or your atlas bone. If that bone is misaligned or not moving properly, what's known as a vertebral subluxation in the chiropractic world, then you can impact the nerve messages that are following and helping to contract the two muscles that are responsible for opening that eustachian tube. Therefore, if a chiropractor helps to restore proper motion and alignment to that segment, nerve messages are allowed clear messaging and the proper contraction and opening of that eustachian tube. And that's where there are thousands upon thousands of case studies and testimonials of children clearing up their ear infections, not because a chiropractor is treating them with medication, but because they're functionally changing or addressing the spine, which is impacting the nervous system. And the diagram is right there for your help and understanding of how that could occur. So what's the bottom line? As in all cases that we talk about, an ounce of prevention equals a pound of cure. The more proactive you are, the less of a chance that even your child or you as an adult is even going to get an ear infection. But we always talk about being proactive and really preventing diseases before they ever start. But environmental factors that actually can lead to inflammation and the immune system being inflamed in that middle ear are things like formula. Formula has a lot of additional sugar compared to breast milk. So with that additional sugar, that's highly inflammatory in the body, more inflammation, more of a chance of otitis media. Allergens also can be factors that cause a hypersensitivity to the immune system, and that overstimulation of the immune system can lead to that inflammation in the ear. Allergens such as dairy, soy, nuts, food dyes, gluten, those are just a few examples of the many allergies that cause a hypersensitivity in that immune system. Daycare centers, again, as parents, I understand we can't necessarily avoid those. But especially when your child or toddler is just starting a new daycare center, they're going to have an over bombardment of these new pathogens, these new viruses and bacteria that they may not have been exposed to before in their own home. So you're going to have a bombardment of that, and the immune system is going to go into overdrive, and that can lead to more otitis media. Smoking, I think that's an obvious one to avoid. And pacifier use, again, it just makes sense with the constant sucking of that pacifier. When you suck, all of those muscles in the back of the throat, including the levator, all of those muscles can contract and open and close, and it might cause a backup of saliva into the eustachian tube and can lead to more otitis media. So the bottom line is those are environmental factors to limit or avoid. And as I hope you got from the last slide, the functional approach, a healthy spine or nervous system. That vertebral subluxation is the locking or misalignment of a spinal segment that impacts the nervous system. And you saw the nerves that go from the brain and contract those muscles that help to open and keep open that eustachian tube. If they're not functioning properly, it could be a result of that subluxation. And if it is, there are ways to analyze it and correct it. And when you do that, kids respond so well to those chiropractic adjustments. And just like my kids, who are now 7 and 3 and have never had an ear infection in their life, again, that's not to brag. I think my kids are special, but compared to yours, your kids are just as special, and they have the opportunity to be just as healthy. So why not give that a shot if your child is struggling with their first ear infection, or it's been a multitude of ear infections? Give it a shot and see if you can find someone or find a chiropractor that could be right for you, that could really help to get your child through in a much healthier way without being exposed to the risk of over prescription antibiotics. As always, I want to thank you so much for joining us. If you have questions, please call or email our office. If you're in the Pittsburgh area, join us for an upcoming office event. We have so much going on, both online like this presentation and in the office. And always feel free to follow us on Facebook and other social media outlets for more proactive wellness. As always, I'm Dr. Dan, here to help you get healthy and stay healthy for life.